this task force. Let's listen in.
Set up this task force many weeks ago. I know you all have been literally working long days and nights. As Dr. Fauci and I spoke yesterday, but for the President's decisive action, not only in establishing this task force, but suspending travel to the United States from China, initiating quarantine efforts for American citizens, and declaring a public health emergency. The American people deserve to know we'd be in a very different place today. But we're grateful for the efforts of everyone around this table. I'm especially grateful for your efforts, Mr. Secretary. Look forward to continue to work closely with you as you chair this task force. The President has asked me to lead the effort at the White House of our administration's response to the coronavirus. So we'll be working closely with this task force. We have added today to the task force the Secretary of the Treasury, Stephen Mnuchin, who joins us here today. Also, Director Larry Kudlow is with us, and Surgeon General Jerome Adams is also joining this team. The President's vision is a whole-of-government approach. It's precisely the approach this task force has been about. But my presence here today and working with you each and every day in the days ahead, I hope gives evidence of the priority the President's placed on this work and our desire to make sure that the resources, information, recommendations are conveyed not only to the public, but also to our partners at the state and local level. Let me conclude by saying that our best estimate is that the threat to the American public, Dr. Fauci, remains low. But the President took the actions he took last month out of an abundance of caution. And he has tasked us to take every step necessary to protect the health of the American people. And I know that everyone around this table is committed to that. On behalf of the President, I want to thank you for your efforts and assure you that in the days ahead, we're going to make sure that the full resources of the federal government continue to be brought to bear in confronting the coronavirus here at home. And I look forward to your recommendations and to your counsel and to being able to carry those recommendations to the President as we continue to deal with this issue. The President has no higher priority than the health and safety of the American people. The work we're doing here today represents the most important work being done in this government today. And apart from our national defense, you are the first line of defense for the health of the American people. The agencies represented here do extraordinary work every day, but I want to thank you on the President's behalf for the work that you've done in fashioning our nation's response to the coronavirus, and I look forward to continuing to work with you as the days and weeks unfold. Mr. Secretary.
Great. Thank you, Mr. Vice President. Next, I will turn it over to Dr. Tony Fauci, who none of you but one member of the media yesterday actually asked who he was, and we were wondering where he had been living the last several decades to not know the great Dr. Tony Fauci, the director of the National Institute of Allergy and Infectious Disease. So, Dr. Fauci, please.
Thank you very much, Mr. Secretary. Mr. Vice President, thank you for being here. I'm just going to take a couple of minutes to do a little brief sketch of the biology of coronaviruses and put it into the context of what we're dealing with this disease. And then we'll talk a little bit about the epi with Dr. Shukat. So coronaviruses before the year 2002 were felt to be relatively insignificant viruses responsible for about 15 to 30% of the common colds that essentially each and every one of us in this room experience every year. But what happened is in 2002, coronaviruses, which also have an animal reservoir, particularly among bats and other animals, actually jumped species, and we proved it retrospectively that it jumped from a bat to what we call a civet cat, which is an animal that is served at feasts, particularly in China, that it jumped from a bat to a civet cat to a human, leading to the disease which we now know as SARS, the severe acute respiratory syndrome. That had 8,000 people and about 775 deaths for a death rate of about 9 to 10%. Then, about 12 years later, when we got to 2012, what we had was the Middle East Respiratory Syndrome, another coronavirus. This one with a death rate of about 36%. And lo and behold, now, in 2019 into 2020, we have a new novel coronavirus. The likelihood that this did the same pattern of jumping species is almost certain. We don't know exactly what the intermediate host was. So we're dealing with now something that's unique and troublesome, as we've seen the havoc that has been wrenched in China with the number of cases they've had, is that this virus has adapted itself extremely well to transmissibility in humans. Some viruses, when they jump species, can be deadly, but they're very poorly adapted to humans. This one has the capability of spreading readily from human to human. It results in a pulmonary disease in those who have serious disease. The death rate, or what we call the case fatality rate, is about 2%, 2.5%. Whether that's the most accurate, we don't know, because it's conceivable that there are enough people who are below the threshold of detecting symptoms so that the denominator of that equation might be larger, hence the death rate may be less. But even that is a serious case fatality rate, because seasonal influenza has a case fatality rate of 0.1%. So therefore, you have somewhat of a serious potential for morbidity and mortality. So right now, what we're seeing is that we're seeing this spreading through multiple countries that you can hear a bit about from Dr. Shukin. What we need to do now, obviously, is the containment, as well as, if it comes to that, the mitigation of the effect of this. So we're dealing with a serious virus that we're taking very seriously because of its potential. So I'll stop there and we'll move on to.
And another.
Thanks, guys. Let's go, press.
Okay.
Mr. Vice President, can you clarify who is in charge of the task force? Is it you or is it Secretary Azar?
The President has asked me to lead our administration's effort in response to the coronavirus.
Are you leading the task force?
I'm leading the task force. We'll continue to rely on the Secretary's role as chairman of the task force and the leader of Health and Human Services. But we've known each other for many years. We've worked together very closely over the years, and the President has every confidence in the Secretary, as I do. But the President wanted to make it clear to the American people that we're going to bring a whole-of-government approach to this. The President wanted to make it clear that what a priority this is for him and for our administration. To that end, I also spoke today and last night with the Republican and Democrat leadership of the House and Senate. We're already beginning discussions over an additional supplemental bill. We'll be leaning on the task force for guidance. But those were productive conversations and very positive. This is the time when the President's made it clear we want all hands on deck. My role is to help lead this effort with the White House Corona Task Force, but also engage our governors, engage local officials, including mayors around the country, and work with members of Congress on Capitol Hill to make sure that all the agencies represented here and our state and local partners have the resources they need to respond.
Thanks, guys.
Is there anything more that we can say about the California case?
That was Vice President Mike Pence giving an update on the Trump administration's response to the coronavirus. He says he'll now lead the task force, but Health and Human Services Secretary Alex Azar will remain as chairman. Mr. Pence says that the best estimate is that the threat from the virus to the American public remains low. More news after a break. You're streaming CBSN.
You can watch CBSN 24/7.
We've got an amazing story to share with you.
Let's talk about the latest developments. There's so many levels to this.
We have a CBS News exclusive.
Fires in California. What happens next, and how does it all play out?
We are on a mission with NASA.
I understand you have some breaking news. It's not over yet, is the bottom line.
This is a massive operation.
It's quite an adventure here at CBSN.
It's been a day.
can see the desperation in the journey simply by looking at the trail that's left behind.
So she says she's 17. She looks kind of like she's 12.
Said to me, you know, if you tried to do this in New York City, take a picture of a man, he'd break your camera.
There's something very, very uncomfortable about this.
Today, a white supremacist lens.
This area can be the new Silicon Valley.
There was not a cot in the warehouse, not one cot in the warehouse.
We're so far deep at this point that there's no turning back. This is a long road ahead.
Good morning to you and welcome to CBS This Morning.
Understanding the world.
We're going to begin with breaking news.
Begins with the right questions.
Have police discovered a motive? Does the president have a red line here?
What can voters expect to see today?
Join Gayle King, Anthony Mason, and Tony DeCopel on CBS This Morning.
We know a little more this morning. This is a major development.
This is a very serious situation.
More news every morning on the show everyone is talking about.
We have much more news ahead for you.
CBS This Morning.
The biggest names in politics.
Whoa, that's news. Are we at a tipping point?
Face the questions you want answered. Face the Nation with Margaret Brennan.
On Saturday, voters in South Carolina will head to the polls for the critical state primary. South Carolina